Good evening and welcome to our COVID-19 update. I'm Ladi Akiri Doluale. Here are the highlights at this hour. Health Minister Dr. Osagie Ehanire says resident doctors should resume work at once, even while dialogue on their demands are ongoing. Federal government clarifies status of Russian vaccine in Nigeria, says Russia is updating Nigeria on work done in the vaccine's production, not submitting it for use. And WHO's chief scientist cautions countries against cutting corners in the race to develop a COVID-19 vaccine. We begin tonight's program with news that as negotiations between the federal government and the National Association of Resident Doctors is ongoing, the Minister of Health, Dr. Osagie Ehanire, is appealing to the doctors to return to work in the nation's overall interest. According to the minister, who was on our COVID-19 program at 6 o'clock, a lot can be achieved if both parties embrace dialogue.
We are propagating the idea that they should return to work while that negotiation goes on, so that they don't allow people to suffer. They don't run the risk of having people lose their lives in the course of trying to fight for their rights or fight for the payment. That can always be done. We're on their side. We are advocating on various fronts. So at the time they will get the money, I do not know exactly. I spoke with the Minister of Finance today, and she has assured us that she will be ready to cooperate with us as soon as all these issues are aligned. But up till the first 3 months have been paid of the hazard allowance up to June. The rest of it is subject to negotiation, which will be done today. Consultants are a category of senior doctors who run the programs. They are supported by youth doctors who are junior doctors. Normally, the consultants oversee the work of the residents, and the residents oversee the work of the youth service doctors. But right now, the consultants will oversee the work of the youth service doctors to make sure that, number one, the COVID centers are attended to. Number two, emergency centers and essential services are attended to. And then routine services are, as much as possible, also attended to. And in very, very difficult situations, they may have to bring in locum doctors. Those are doctors who are hired to stop gap so that their services are not totally disrupted. The ministry has a responsibility to ensure that Nigerians continue to receive health service.
On the COVID-19 vaccine from Russia, Dr. Ehanire says what the country's ambassador did was to present a snapshot of the vaccine production processes to the federal government.
The vaccines are not yet out for distribution. They are still being tested. And there's no country that's actually applying them yet. Nigeria, we have the responsibility here as Minister of Health to ensure that Nigerians are able to have access to those vaccines when they eventually become available. So the Russian ambassador came to give us just an idea of what they are doing. They submitted and did a memoir that told us how far they had gone with testing their vaccines. The tests they have done, they are already in phase 3 tests. And we also had them have a conversation with our experts here, advisors, Professor Tomori, and the director of the Institute of Nigerian Medical Research, and also the chair of the Nigerian Bio-Vaccine Limited, who also asked questions as to the possibility of licensing for production here, or collaboration, technical collaboration with the Russians. We have also, of course, been in conversation with American authorities and also with World Health Organization. So we're looking at all areas, all channels to secure availability of vaccines for our citizens when they come out. Of course, they all have undergone the necessary tests and validations before we go into that. So we're just casting our net wide to be sure that we do not lose out when these vaccines become available. We were told that the Russians already have 20 countries that have registered for theirs or have expressed interest, including Saudi Arabia, United Arab Emirates, India, Mexico, and several other countries. So we are on the list there, expressing interest and hoping that we can have further conversations with them, with our technical team and theirs.
The federal government has ended a conciliatory meeting with members of the Nigerian Association of Resident Doctors to resolve issues that led to the declaration of a nationwide strike on Monday. At the resumption of the meeting earlier in the day, the Minister of Labour and Employment in Abuja and members of the federal government negotiation team described the industrial action by the doctors as unwarranted and illegal. Both the Minister of Labour and Employment as well as the Minister of State for Health maintains that the federal government had already attended to 6 of the 8 demands made by the doctors, saying that the strike was only a ploy to discredit the government. After the opening remarks by the ministers, the meeting then entered into a technical session with hopes to resolve the impasse. The striking resident doctors are demanding, amongst other things, the provision of group life insurance for doctors and other healthcare workers and payment of death in service benefit to next of kin and beneficiaries. The universal implementation of Medical Residency Training Act in all federal and state hospitals and ensuring pay parity among doctors of equal cadre. Immediate review of the hazard allowance of healthcare workers and payment of COVID-19 inducement allowance as agreed during a stakeholders meeting. The immediate release of funds for medical residency training for 2020 as captured in the revised 2020 appropriation bill, as well as payment of all owed arrears of the consequential adjustments of minimum wage to her members and the implementation of such in state tertiary health institutions. The payment of outstanding April and May and June COVID-19 inducement allowance to health workers, and the immediate payment of the salary shortfalls skipping of 2014, 2015, and 2016. Doctors working under the various tertiary institutions are to be placed on appropriate salary grade levels, and universal implementation of the Medical Residency Training Act of 2017 is to be undertaken. Well, with the resident doctor strike in day 2, the Universal College Hospital in Ibadan says consultants have been put on standby to fill the gap created by striking doctors. The Chief Medical Advisory Council Chairman of UCH, Dr. Victor Akimoladu, told Channels Television that services are fairly stable with the consultants attending to patients and admission while emergency services remain active. The chairman of the UCH chapter of the Resident Doctors Association, Dr. Adidaya Williams, says there's no going back on the strike as government has repeatedly abused chances of dialogue by not respecting the agreements reached with the unions.
There are 567 resident doctors here at the UCH, and currently they're all not working.
We've been agitating for some things for years, and recently during the onset of COVID-19 pandemic, which include but not limited to provision of personal protective equipment for doctors and medical health workers, payment of COVID-19 inducement allowance for doctors and other health workers, payment of medical resident training funds to fund medical residency for doctors, and salary shortfalls for 2014, 15, and 16.
But according to management, they have activated emergency protocol to make sure that the consultants stand in the gap while the strike lasts. Something urgent has to be done, because from feelers that we have here, the ARD is co-opting other health officials, and if it's not resolved this week, Dohesu too might begin strike next week. Bukola Oriowo, Channels Television News.
Following a lack of cooperation by members of the public with the safety measures for prevention of COVID-19, the Niger State government says it has changed its strategy in enforcing compliance with the protocols. Its Commissioner for Health, in an interview with our correspondent Emperor Simon in Minna, also gave an update on the spread of COVID-19 within the state.
As of today, we have 244 cases. You will recall that some few weeks back, His Excellency directed that everybody in the council at that time should be screened, where we have 2 positive cases. The other day again, His Excellency the Deputy Governor directed staff of his office, because there was also some level of violation, should also be screened, which was also done, and there were 2 positives. Yes, we know that there are what we call carriers. Carriers are those that can harbor the disease, but it doesn't do them anything, but they can infect others. So again, we have discharged our last set of patients on admission as at about 3-4 days back, but that does not mean that we'll close down our isolation center. They remain active until when this disease is over. However, there are some level of protocols that are being changed on a daily basis. For instance, recently when you have a positive patient that is symptomatic, he doesn't need to be admitted into the isolation center, especially if he can self-quarantine and obey situation. Our molecular lab, definitely because of modifications and then, of course, physical space constraint, there are some little delay, but we hope that within the next few days, that laboratory will be put to finish, and we are ready to commission it very soon.
Let's talk now to Dr. Dukbe Akinyinka, consultant public health physician. She joins us via Skype from the Festac area of Lagos. Good evening, Dr. Akinyinka. Thank you for your time this evening.
Good evening, Mr. Ladi. Thank you for having me on the program.
From everything that we know now, I mean, putting aside the resident doctors' strike and the issue of welfare of medical personnel for just a second, what is your own take on where things stand with us and COVID-19 as at today? Are you optimistic? Are you in the middle? Or are you pessimistic?
Definitely, I'm optimistic. I'm optimistic because we have been through a whole lot in this pandemic, and as it stands now, we have about over 11,000 active cases, which is similar to what we had about a month ago. That is the number of active cases. So I believe we're winning the fight, but that does not mean that we should rest on our oars. We should strive harder to ensure that we follow the protocols, we follow the precautions, we do what we need to do so that we can completely overcome this pandemic at this point in time.
That brings me to the main subject of my discussion with you this evening, which is, it does look as if, in spite of what medical officers like yourself have been saying in the last couple of months, the reopening of parts of the economy has meant that people have thought and do think and have said that life has gone on. And they are behaving in accordance with that thought, which is that they're not observing the protocols anymore. Some of them have, in fact, said, well, it has come and it has gone. So it brings up the question, how do we bring in the COVID-19 case management into the normal health delivery system of the country, such that it is no longer an emergency, it's part of what we do on an everyday basis, because it seems as if that is what is likely to be next now?
Yes, that is what is going to have to happen, because until there's a vaccine, there is still that likelihood that there will still be infections coming up with COVID-19. And so we need to integrate the recognition of COVID-19, that's the identification of cases, the tracing of cases, the management of cases. We need to integrate it into our health system. Now, our health system in itself needs to be thoroughly strengthened. So, and that would, take us back to the issue of the strike and all, because the human resources are a major part of the health system. And so they definitely have to be properly taken care of. That issue has to be addressed, the financing of the health system and all of that. So all of that has to be addressed. Now, within the health system, we find that what is meant to obtain is that people are supposed to access health care from the primary health care system. That is, primary health care is the basis, or is the place where most of the population should access their healthcare. So in integrating it, it should start from the primary healthcare, such that at a primary healthcare center, people can easily walk in, access healthcare, and then, of course, get also the screening for COVID-19. If they do have symptoms, when they get there, they should be screened accordingly. And then if they fall into the category that whereby we find that they need to do a proper test, then testing should also be available. And testing is something that we have not done so much of as well, because we've only tested about 0.2% of our population or thereabouts. And that's still rather a small proportion of the entire population. So the testing has to be part of that integration so that people can walk in, they can get tested, and then they are notified of their results. And if they need to go, they need to be isolated whether at home if they have no symptoms or in an isolation center, then all of these need to be brought together and to work, seamlessly, such that it becomes the usual, so that we're just working, with that system in place. And this integration can take place with our IDSR, because we already have an IDSR system in place. That's Integrated Disease Surveillance and Response. We have that in place already. So it's just a question of integrating COVID-19 into that, whereby people can report if they have, if they suspect cases, and then they can go for testing, they're followed up, and then the cases are managed as appropriate. So we really need to integrate it into our system, starting from the primary health care system. And then as we graduate into the secondary health care, and then the tertiary as well. Of course, with all of these, with these different health centers as well, once clients or patients come into these centers, then of course a quick triage needs to be done, so that as much as possible we can catch whoever it is presenting with symptoms similar to COVID-19 symptoms, and then we can quickly test these ones as well, and then ensure that...
Dr. Akinka, let me put you on pause. Let's take a quick break. When we come back, I'm going to ask you to conclude your thought, as well as take a look at what happens to all the facilities we have put in place in the last 6 months. Where will they fit into this new system? But that will be after the break. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Before the break, we're talking with Dr. Dupe Akinka, consultant public health physician, who is joining us tonight from the Festac area of Lagos. Dr. Akinka, before the break, I said I would ask about what happens to all the facilities that have been put in place, the laboratories for the testing, the isolation centers that you mentioned in your answer. How do those get integrated into this normal system that will not feel like an emergency situation, which is what we have had more or less in the last 6 months? Where do all these facilities fit in?
Okay, well, with, for example, the laboratories that you mentioned, with those laboratories, they are going to fit in perfectly, because they are high-level biosafety labs. And so we need such labs, because COVID-19 is not the only communicable disease that is affecting Nigeria. We've been having Lassa. Thankfully, we have been able to get rid of polio, so, and then there are other diseases as well that these labs would also be able to cater for. So the labs are perfect. They should continue to run, and they should continue to do, all of the testing that they have been set up to do, because we need those labs. Because at a certain point in time, if you wanted to test for Lassa fever, you had to we had to transport samples, all the way to Edo State or thereabouts, and that delays results. It doesn't help the system if people cannot access the necessary tests. So all of those labs should then be able to do more tests, a variety of tests, such that they are more useful to the health system, and they are not just testing for COVID, they are testing for a large variety of communicable diseases that still occur in this part of the world. Now, when we talk about the isolation centers, the isolation centers, even in Lagos, we already had an isolation center in Yabade. So the facilities that have been put up as isolation centers, once we're not really using them anymore, then all of the materials and as much as possible as can be taken from these should now be used in the built-up isolation centers, because there's no way we're not still going to need isolation centers. We cannot predict the occurrence of pandemics. So we need to ensure that we still have, isolation centers that can cater for patients at short notice, such that we are ready. It's a readiness thing, so that we are at every point in time ready for the occurrence of any pandemic. And that way, we're quickly able to test people, we're quickly able to isolate them and get them treated, and then we will not be caught unawares.
Finally, I'm going to give you just a minute for this. Do you think, I know at the beginning you said you were optimistic, but do you think that given what is going on now in our case management portfolio, we will be right to expect that it is possible that we may have a second wave, especially with all the things that we're opening, the airports, the schools, the universities, and so on, that are opening in the last couple of weeks?
Yes, it is possible to have a second wave, which is why, we are sounding that note of warning that we know that we're not having as many cases as we were having previously, which is a good thing. But we should not rest on our oars. We should keep taking those precautions. We should keep washing our hands. We should keep physically distancing from people such that we're able to prevent fresh infections. And then, of course, we should also always wear our mask once we are going out to a public place, and particularly places where physical distancing may not be as feasible as we would want it to be. So we need to keep taking those precautions. We must not relax at this point in time, because we don't want to have a second wave that will now lead to further loss of lives. We've already lost enough people. Over 1,000 people are dead from COVID. We don't want to lose any more people, and so we need to keep sounding that note of warning. We need to engage people so that people are aware that they need not rest on their oars now. They need not relax now. This is not the time to relax. This is the time to keep taking those precautions and ensuring that we are finally able to get rid of COVID, or at least get it to such a degree that it is no longer affecting a huge number of people in our population.
Aki Yinka, consultant public health physician, for your thoughts tonight. Thank you for joining us.
Thank you very much for having me on the program.
The Nigeria Center for Disease Control has announced 296 new cases of COVID-19. This increased the number of active cases by 187 from yesterday, putting the cases on admission at 11,055 after 105 persons recovered in the last 24 hours. As of today, the total number of confirmed cases stands at 55,456. 43,334 persons have recovered, and 6 more deaths leaves the death toll at 1,067. A breakdown of the new cases shows Plateau State leading with the highest at 183, followed by Lagos at 33, the FCT 25, Ogun 16, Oyo 7, Ekiti 6, Kwara and Ondo 5, Imo 3, same with Anambra and Nasarawa. Rivers, Gombe and Edo have 2 each, while Akwa Ibom has 1. Plateau State in recent times has had a daily rise in cases, topping the list of states with new infections. But according to the state government, that's due to a backlog. And according to a statement by its Commissioner for Information and Communication, the state now has 3 testing centers and there is increased community testing. The COVID-19 pandemic has made more Borno children vulnerable to exploitation and abuse. And that's according to the UNICEF Chief of Field Office in the state, Maulud Warfa. There are more street children than there were before the pandemic started, and the result is despair. UNICEF believes children are the group most affected by COVID-19 and its attendant consequences. And this formed part of an engagement in an education stakeholders meeting in Maiduguri, marking a new day set aside to protect education from attack. From where our correspondent, Blessing Chuno Aso, has more.
Today, September 9, marks the maiden commemoration of the International Day to Protect Education from Attack. International and local NGOs, relevant government agencies, and stakeholders are discussing ways to push the agenda of education in Borno State. During the meeting, it was agreed that Borno State has faced the twin tragedy of the effects of insurgency on one hand and that of the coronavirus pandemic on the other hand. Now, the pandemic is coming at a time when efforts are being made to reduce the number of out-of-school children in the states. UNICEF is also worried about the increasing rate of child abuse in Maiduguri, which is also another outcome of the pandemic and the closure of schools.
Education stopped existing in terms of children going to classrooms and in terms of children learning. A lot of their socialization activities had been stopped. That affects children psychologically. I had a lot of the time met children and interviewed them in their homes, and the biggest challenge they have is that connecting with their children, with their brothers and sisters, with their classmates outside the confined environment is what they see as a key thing. But also many children that are not in school became very vulnerable for exploitation, abuse. I have seen a lot of Almajiri children that are on the streets that would have been or must have been affected by the virus itself.
The ongoing WAEC examination is a litmus test for the reopening of schools, according to officials.
For the exit learners who are currently writing their exams, the exam will continue, and we have been monitoring with keen interest to make sure that if there is any case of COVID-19 in any of the schools, we will take note so that very strong measures will be taken. But in a situation where there is no case reported, then eventually it's a signal for us to open the other arms of learners.
From Maiduguri, the Borno State capital, I am Blessing Chuno Aso for COVID-19 updates.
Let's get another perspective on our topic tonight. Dr. Oluchi Kamal Kafo, consultant public health physician, as a senior lecturer at the University of Lagos, joins us via Skype, this time from Lekki. Good evening, Doc. Thank you for your time this evening.
Good evening. I'm glad to be here.
We've been talking about making putting COVID-19 and its facilities and its treatments and its protocols into the new normal of the healthcare delivery system, because it does appear as if it's going to be around for some time, so we can't leave it at the level of an emergency forever. Do you think that is feasible, especially given the state of the country's healthcare system as it is today?
Thank you. Yes, it is feasible, even though the healthcare system has challenges, but it is what we have to work with. Now, the focus of the health system when it comes to preventing COVID-19, or in the light of COVID-19, is one is prevention. And the second thing there is to be able to sustain essential services. Now, even though things haven't been great with our health system, but it's important that a few things need to be put in place. If we can harness a few things, then we can work with what we have. It's important to note that, yes, we have a lot of work to do with our health system. We have a lot of things to put in place. But if we apply the basic principles of disease prevention, like we already know, if we can keep maintain social distancing at the health facilities, keep people at safe distances from each other, make provision for people not to be in crowds, provide PPEs, have people apply hygiene before coming into the health facilities, get people informed, we should be able to work. Another thing, again, is for people to know the facts about COVID-19, keep updated, the healthcare workers, even the individual coming to the health facility. If we can keep ourselves updated, get the right information in, then we should be able to work. Then another thing, again, is ensuring safe operations. Now, the operations of the healthcare system are known and well understood. Now, we can make these procedures and processes safe, applying the appropriate IPC measures, infection prevention and control measures. If this can be achieved, then we can open our health services to be able to provide the healthcare we need. Another thing, again, is to establish procedures to handle unwell persons, so that when an unwell person appears at the health facility, if we can find a way to get them to get a separate kind of care from everybody else, that is, give the health facility provision to handle people who come in unwell, separate the well from the unwell, or separate those who appear with symptoms that are similar to the disease at hand from those who do not. This should be able to help. Another thing is to promote information sharing. Now, we have the system, the IDSR system, that is integrated disease surveillance and response system that enables us to be able to report disease at different levels. This can be strengthened. If we can apply new innovative measures to use apps or use the internet to facilitate this process and enable quick and real-time disease reporting, it would really help so that the appropriate measures will be provided as and when they're needed. Another thing, again, is to help monitor attendance at hospitals. For example, if a person showed up, the person's details, address must be collected so that should there be an event, people can be adequately traced. So collecting of vital information has to become very important. Then another thing, again, is to leverage on remote activities. We talk about telemedicine. We talk about mHealth. We talk about using medical appropriate apps. It's time to leverage on these so that if a patient doesn't need to come into the health facility, having a doctor attend to them, even by phone or using a measure such as we are using now, Skype, it could help so that it's not everyone who needs to come into the health facility. Another thing, again, is to educate health workers, the community. Yes, people are hearing a lot about COVID-19, but we need to hear more. We need to know more. New information, updated information needs to go out so that people know how to respond to the institution at hand. Then another thing, again, is supportive services. If we can have people receive supportive care so that nobody stays away from the health facility, vulnerable populations, if they can be provided for, such that when they have conditions similar to COVID-19, they can come into the health facility and there's provision for their care. Another important thing, again, is looking at things at a broader scale. It's time for us to begin to look at local solutions, begin to adapt these solutions, not just adopting them, but adapt them to our local situations, local contexts. Another thing, again, is to encourage research. Research will help us know where we're going and help us evaluate where we need to put our strengths. And that thing, again, is funds, funding, research funding, healthcare funding innovation. Once there's probably a new app, a new platform that can aid our work, it should be funded. Then things like grants should be given to healthcare workers and researchers. There's something called the physician researcher. The physician researcher should be encouraged so that as they're working, they're researching based on their findings right there at the bedside. Another thing again is to use the public health physicians. Public health physicians are trained for the purpose of handling epidemics like this. Let's use our public health physicians. Another very important thing again is taking healthcare to the community level. Healthcare is best handled using primary healthcare, which is the model we have adopted. Now, primary healthcare feeds the people right there in their communities. We have the community health officers, we have the community health extension workers. People like that should be given the responsibility and empowered to be able to identify these cases so that nothing within the community is missed. That way, people can come into the health system straight from the community. They can be identified in the community. The community health workers can even help with contact tracing, help with surveillance, help with providing people with information right there in the community. And so many things. Surveillance should be strengthened. We should begin, the one we are doing right now, using the app that we're using right now, this should be strengthened, should be scaled up, as well as also scaling up those procedures that help us to identify those who are affected, and that helps us to identify where treatment is available, where testing is available. Those ways by which we disseminate information should be strengthened as well. And then finally, training and retraining of health workers. It should be ongoing so that wherever the gaps are in maybe infection prevention and control or understanding the disease, emphasis should be placed on those areas. We're looking to provide a resilient health system. Remembering that the way the disease is spread, it is through droplets, person-to-person contact with surfaces, it's airborne. If we can apply this knowledge to strengthen what we already have in our health system, I think we should be able to provide the COVID care along with other disease conditions so that we can move away from this situation where it seems as though the health system is shut down and all attention is on COVID. Thank you.
Indeed, Dr. Kamal Kalfor, I just couldn't get a word in because your points move from one to the other, to the other, to the other, and one can only hope that the health authorities are listening and are taking notes of what needs to be done in this regard, because that is the next step, of course, in where we're going. Let me thank you for your time on the program this evening. Dr. Kamal Kalfor joins us, of course, from the Lekki area of Lagos. Thank you for your time, and do have a good evening.
Thank you.
The World Health Organization's chief scientist, Dr. Soumya Swaminathan, has warned against countries cutting corners in the race to develop a vaccine against COVID-19. During a press conference today, she said, quote, "Just because we talk about speed and skill doesn't mean we start compromising or cutting corners on what would normally be assessed," unquote. As the process, she says, still has to follow full rules of the game. Her plea comes as the trial of a leading vaccine developed by AstraZeneca and Oxford University is paused due to concerns over side effects in one of the participants. Here's a global update.
The nature of the safety issue with the AstraZeneca vaccine on the participant and when it happened is not immediately known, but the participant is expected to recover. A report from AstraZeneca says suspension of the trial is having an impact on other AstraZeneca vaccine trials, as well as on clinical trials being conducted by other vaccine makers. In other parts of the world, Italy's former Prime Minister Silvio Berlusconi, speaking for the first time on his condition since he tested positive for the coronavirus, told supporters that the virus is very bad, and that of the thousands of coronavirus patients treated by doctors at the San Raffaele Hospital in Milan, he was among the worst cases they had seen. Meanwhile, the number of coronavirus cases in the United States is still on the rise, as the country remains the epicenter of the pandemic, with more than 6.3 million cases and nearly 190,000 virus-related deaths. Data from the Johns Hopkins University shows that Midwestern states of Iowa and North and South Dakota have emerged as the latest hotspots after a spike in new cases. The surge is being attributed to the reopening of colleges and an annual motorcycle rally held in South Dakota last month. Venezuela says the Russian locally licensed coronavirus vaccine will be delivered to the country this month for clinical trials. During a televised address on Tuesday, President Nicolas Maduro said other vaccines would also arrive in the month of October, although he did not specify which ones. Spain's health ministry says hospitals are not in the situation they were at the start of the pandemic, where they were on the verge of collapsing. But local media say hospitals are under pressure as Madrid racked up 30% of new cases reported in the country. France is currently battling to avert a second wave of coronavirus, as authorities say the virus is especially active in and around Marseille and Paris, France's two biggest cities. The number of confirmed COVID-19 cases in France rose by 6,544 over 24 hours to give a total of 335,525 cases. The number of deaths also climbed by 39 to reach a total of 30,764.
That's our COVID-19 update for tonight. For details of the stories you've heard here and indeed the details of other stories about COVID-19, as well as the exclusive interview with the Honorable Minister for Health, Dr. Osage Hanere, visit our website, channelstv.com. I'm Ladi Akere Duluale. Do stay safe and have a pleasant evening.